Hi, welcome, Catalina. Thank you so much for joining us today for this moving along video. I'm excited to talk to you today about the talk that you gave at the MDS-PAS, which was a great talk on the digital divide. It's always lovely to meet all of our various neurologists and other healthcare providers across the Americas at that meeting, and we met in your home country of Colombia. I was just really opened my eyes to a number of interesting facts, and I thought we'd share some of them here today. So maybe first of all, we can just start by asking you a little bit about where you are right now, and tell me a little bit about your sort of interest in this topic.
Yeah, well, sure. Yeah, it was it was a great way to go with everyone from all the past Congress, all the past section on from the MDS, and talk about the differences between the regions that sometimes, well, we think that it's super different, but we sometimes we feel or we find really a lot of things that are really similar. So, well, now actually I'm in Canada doing my PhD. I am also affiliated to the San Ignacio Hospital in Bogota, and I was a professor of neurology in an a clinical adjunct professor of neurology in Javeriana University. So yeah, I had the opportunity to talk about all these differences between the regions.
Well, it sounds like you have experience because now you're in Canada, but you also have been in Latin America as well. So that's also exciting. And I'm based in the United States, and so I think we have a lot of different angles to look at this. So maybe we can start with sort of what some of the basic sort of issues are in terms of, you list a number of barriers to adoption of some of these sort of devices. And when we talk about, sort of the digital divide, maybe you can start with even talking about what kind of digital things are we even talking about?
Yeah, well, we talk about the wearables and all these new digital tools using for monitoring different symptoms of the disease, motor and non-motor symptoms. And we're talking about not only wearables and sensors, but also other kind of tools like smartphone-derived measurements or mobile apps used to track different symptoms and things from the for the disease. And I think that one of the things that we found, because we try to do a little bit of survey between asking our colleagues, our movement research colleagues from the States, from Canada, and the whole countries in the Pan American section in Latin America, which barriers they found. And we found a lot of barrier actually. One of them, for example, in North America, people thought that maybe difficulties with them, they thought, they feel that sometimes this relationship between cost and the benefit was not so clear for all of these for some of these devices. But in Latin America, for example, difficulties with cost or barriers for implementation also were found. So we found some differences between how they feel that maybe there are barriers to implement these tools.
Yeah. So you surveyed the doctors and largely, right? And you had about, I think, 98 respondents. So what were the main barriers, would you say? You mentioned cost, you mentioned the issues with implementation as well. Are there other things that you learned in the survey that you wanted to share with us?
Yeah, no, absolutely. Actually, we found things like difficulties with the implementation with related to the digital literacy. Some of the colleagues thought that maybe, for example, patients of some ages, like older patients, could have difficulties to use these kind of tools, and it can really have a disparity between patients with high digital literacy and patients that usually don't sort of use this kind of tools, for example.
Absolutely. And it sounds like, even the patients are unclear about, I think the patients have a sense of what makes a difference for them. And then the clinicians also have a sense of what they want to learn from these. And there sort of seems to be a disparity even there. So maybe you could describe a little bit about what you found.
Yeah, yeah, absolutely. Well, we talk more about these kind of barriers beyond all the answers from the colleagues, and we found that, for example, the way how the devices really interpret the symptoms, and maybe it's not the way that in one side maybe the specialists, the doctors want to know these kind of symptoms, and most importantly maybe it's not the way that the patient, actually the people with Parkinson's disease, want to be monitorized about these kind of symptoms. Or maybe these are not the symptoms that are more important for the patient, maybe are more important for the clinician, or maybe people that do this kind of devices think that is more important, but how patients actually feel about them, I think is the most important, and it's the one of the most important barriers on this.
Yeah. One of the things that was highlighted was sort of the concept that the patients are worried that by using some of these devices and sort of getting this data, that they may lose the human touch of even having a clinician who talks to them and spends time with them and treats them with compassion on a personal level. So I think another thing that you mentioned was that patients really want to have more of their non-motor issues talked about, and that a lot of these devices focus more on the motor aspects of things.
Yeah, no, absolutely. Um, if- Actually, patients thought that, and in general, we see that for these kind of devices, a lot of the devices are addressing actually motor symptoms, gait, motor fluctuations, bradykinesia, dyskinesia, but maybe some of the other non-motor symptoms that maybe sleep, depression, anxiety, or even other emotional, addressing other emotional things, loneliness, for example, how to deal with the stress and how to deal with the decisions about the disease. Maybe they are more important for some patients, and most of these kind of devices actually don't address this kind of stuff. And the other important thing is that maybe some clinicians think that using these kind of devices is not like the best way to diagnose a patient, because, well, that's true actually. I mean, it's important that we all know that the diagnosis actually is clinical, always in Parkinson's disease and in many other neurological disorders, and it implies that you also need more than only the things that actually make the diagnosis 1, 2, 3, and 5, and you have the diagnosis, but you need compassion. You need this sort of feeling to tell a patient that has a chronic disease, and you are labeling a person with a diagnosis for all the life. So this kind of thing probably you cannot find this kind of thing, of course, in this kind of tool. So it's the way how you really include these tools in your clinical practice to help you to give the diagnosis. I think it is the most important here.
100%. Yeah. I mean, I think it's, as you mentioned in the talk, you talked about, the complexity, the nuances, sort of how you sort of, we as clinicians are able to kind of pick up on things that may not easily be measured. And then when you have big data, and then it teaches big data sets, more big data without really the sort of human touch, I think sometimes we can really go off into the wrong sort of, interpretation. So I think we definitely have to keep, I think none of us are going to lose our jobs anytime soon. Let's put it that way.
Yeah, no, absolutely. I mean, we are not afraid of that, of course, and it's important to not be being lost in the translation of this kind of the way how the tools actually measure the things, and the way how we interpret this kind of symptoms. Yeah.
Also, you mentioned that, interestingly, I guess compliance isn't great. So we all think that patients want these gadgets and that they want to use them to inform us. But, it looks like there's a pretty big drop off from what you had mentioned. There's also been issues with using different platforms. Various different companies are trying to do their own thing. And so, standardization is lacking. And so, it really becomes sort of one of these things where I think we end up also, again, studying populations that are, again, very niche. So people who have access to the digital technology with internet and devices in the first place are the ones that are able to participate in this type of research, which again leaves out the populations that I think you and I are passionate about including. So I think there's many sorts of issues that you've brought up in the topic in your talk that really opened my eyes to some of these things.
Yeah, absolutely. Well, there are many gray areas in this regulatory thing that you mentioned, the compliance, these things about confidentiality. Actually, we know that FDA, for example, has granted clearance for many devices, but we don't have yet like primary and secondary endpoints or digital endpoints. Only the we can use it like exploratory endpoints. So yet it's not something like so solid about that. And how these different kind of tools are being developing by different people with different futures, and it makes very difficult to try to homogenize and to standardize the results, and then you need to apply these results to other kind of population. And this is super important because you mentioned the need for inclusivity and for generalizability. So if these tools are being tested only in one kind of population, and then you will try to use them in other kind of population where they were not actually tested, maybe it's not the same. Maybe you will see that the results are not the same. If someone is in North America, for example, that go in a car from one place to other place, so maybe only takes 10 minutes to go one place to a place. But maybe, for example, in Colombia, you have farmers in the mountains that working and all the day. So how can they use these tools if the result that you see in the studies is the same? If they apply for this kind of people, or for a housewife that is taking like 2 hours in a bus in a crowd city like Bogota, for example, to go from her job to home. So this kind of thing, really, we need to talk about how inclusivity is really needed in this kind of studies and include all kind of population.
100%. So you also proposed, I think in your talk, not just the barriers, but you also proposed some solutions. Some of them were kind of very interesting, sort of including patients to understand what their outcomes are and then creating measurements around that. Can you tell me a little bit more about some of the other things that you had talked about in terms of solutions?
Yeah, well, we talk about opportunities, and one of the most important is to implement or include these things. We are talking about the importance of a holistic approach in the management of Parkinson's disease. For example, of course, that you have wrote a lot of this come from you, and I think we have to incorporate this concept also in digital health. It's super important. In that way, we can really cover all the things that maybe are missing in this kind of approach with the normal, the regular digital tools that have been used. And it's important also that you collaborate with data sharing, because to try to standardize all these kind of results. Of course, that many of these studies have been done in North America, in Europe, and maybe try to include this kind of tools in many of the initiatives that actually are running in South America, Latin America, and other underrepresented countries. We have many consortia, for example, in genetics, in premotor PD, and maybe try to include this kind of tools in this population, at least to try to test it in this kind of population also is important. We really need to leverage the thing of the thing that actually the smartphone use is increasing. in all the world, and maybe it's not easy to have a computer at home, but maybe it's easier to have a smartphone in some countries. So maybe use not only wearables that are very expensive, but maybe use or create mobile apps that are more interesting for patients, that to increase the adherence of patients and maybe decrease cost. I think is important to try to include all kind of patients.
100%. And I think, you brought up some good points about, having the digital literacy in the first place. So if people are afraid of what technology can do, I know some older people in my own family are worried about, using things that have cameras on them. They're worried that somebody's going to steal their information, or, there's a lot of, concerns, I think. So we need to really address them head on, and be honest about, who is able to use these and really harness this technology for all, not just for some. And I think we have a lot of work to do in this space, but I think it is very exciting. Some of the statistics of, for example, I think in Guatemala, I noticed that almost 100% of people may have a cell phone by 2050, which is actually more even than the projected cell phone usage or smartphone usage in the United States. So really interesting sort of groups of populations with disparate needs, some around, availability of broadband or internet in the home. Some are dealing with just the literacy of being able to, log on, and others are, have access but may not be compliant. So I think, very different issues across various different populations. But it's a very exciting time, I think, to really think about these things and try to find solutions. So
yeah, absolutely.
Thanks so much.
I think there are a lot of education. We need a lot of education here.
Yeah,
on this
100%.
topic.
It was a very interesting topic, and I loved hearing about just the North American and comparing to Latin American sort of experience. So hopefully we can also get a global perspective from some of our other colleagues as well. Well, thanks so much for this great interview, and we look forward to more of your results in the future.
Yeah, super happy to be here. Thank you.